We there? All right, good evening. Today is it's 11th of November 2024. Welcome to my live today. It's exactly some minutes past. It's 10 minutes past 7. We are a little bit late today by only 10 minutes. It's 10 minutes past 7. All 10 minutes past 19 hours East African time. Welcome to my live today. And as usual, I will request you to ask questions regarding reproductive health. I need questions regarding reproductive health, things to do with fertility, reproductive health. Those are the issues, questions I welcome. Issues concerning I've failed to conceive because of ABC and I have fibroids, I have this. Those are the questions we are going to answer today. Thank you so much for following me, and please, if you're new on this channel, on my YouTube channel, please do not forget to subscribe and also become a member of Ask Dr. UTHUMAN. I told you there are a lot of benefits when you become a member, and I think most of you know that. So today it's a Q&A. So just answer your question. You ask your questions, I'll be able to answer. Now let's start right away with question number 1. And I said that if you'd like to get in touch with me or to have a private conversation, if you don't want to use the social media and you want to be private with what you're asking, go to the website. It is www.druthman.com and book an appointment. And I also want to tell you that when you book an appointment, it doesn't mean that I will answer you immediately, because there are very many people. I have very many appointments, so you'll be scheduled on a day where we shall be able to chat on one-on-one. All right, so let's start away with the first people asking questions, and this one is called Jennifer Ndegigwe is saying, Doctor, please, can I get pregnant after 1 year after cesarean section? Yes, it's possible you can conceive a year after cesarean section, but we do not encourage someone to conceive with it just after a year of cesarean section. We encourage you to conceive after 18 months. Minimum should be 18 months. Actually, to me, the people I work on and most guidelines will tell you to conceive after 2 years. Okay? So, virus detected is showing limited internet. Virus detected is showing limited internet. Are you having internet? Okay, let me go to this. Let me use another one. So what I say is that we encourage people to wait at least 2 years. To wait for at least 2 years. Then after 2 years you can conceive. And other people, I will encourage them to wait for 18 months. So if you really want to be very fast, the earliest should be 18 months. But we tell people to be to wait for 2 years. Why so? Why do we tell people to wait longer, to wait for at least 18 weeks? Remember, when we're doing a cesarean section, we cut through the uterus. Okay? We cut through the uterus, we cut through the womb. And therefore, when you cut through the womb, you have to allow it to heal. Okay? That process of healing takes some long period of time. And even after healing, you have to allow the muscles to attach to attach themselves together and have that strong adhesive force to have that strong cohesion, okay? Muscles attached to each other. In other words, it should be really, the uterus should become normal again. But if you conceive before that period of time, most times, remember, the uterus is still injured. It's not yet healed very well. The scar is still fresh. The scar is still, it's weak. And therefore, when as the pregnancy progresses, you may end up rupturing your uterus. Therefore, to avoid the risks, those emergencies of uterine rupture, we encourage someone to have at least a period of 18 months. 18 months to 24 month or to 2 years. That's what we encourage you. I think, Miss Jennifer, you've understood the question. You've understood, you've gotten the answer. This one is called Fatima Yusuf Usman. He's saying, good evening, doc. Please, when can someone know his baby gender? At which weeks? At 24 weeks, 24 to 26 weeks, you can do an ultrasound scan. Well, most ultrasound scans, those that don't have a proper resonance, will give you, those that don't have a proper resonance will give you up to at 26 weeks. But the strong ultrasound scans with good resonance capacity, they can give you even when you are 24 weeks. So 24, 26 weeks, you can know the sex of your child. This one is saying, this one is motivate me, is saying, how do I have a male child? How do you have a male child? If you want to conceive a baby boy, I always encourage women to have sex on their ovulation day. The problem with that is that the problem with this is that I usually tell people to have sex or to have intercourse on their ovulation day. Then after having sex on their ovulation day and they fail to conceive, they will tell you, doctor, you told me to produce a male child, you have to have sex on your ovulation day, but I didn't. What happens is that we want you to eliminate, not to have sex, to abstain during the other days. Because I think you should check in one of my videos. There is a video where I talked about how to conceive a baby boy, a baby girl. That video is there. You check on the videos on my YouTube. It's there. But what we are saying is that, remember, 5 days to ovulation. Okay, 5 days to ovulation. If you have sex 5 days towards ovulation, that will be a baby girl. So if you have sex 5 days towards ovulation, you'll have, even if you have it again on the ovulation day, you may not be able to conceive a baby girl, a baby boy, because you'll have conception will have happened. Okay, so we encourage you to abstain these all the fertile days and only have sex during your ovulation day, or at least 2 days to your ovulation. And there is a full video, I think you can check it, a full video which is explaining everything to do if you want to have a male child. Amina Bashir channel is saying, please, what are the treatments of hydrosalpinx of the right fallopian tubes without surgery? Yes, now if we have, because hydrosalpinx is of 2 types. There are those that are infectious. If it's infectious, okay, you are going to use antibiotics. And when we are using antibiotics, it depends on how severe the hydrosalpinx is. But if it's not infectious, okay, then you'll have to do tuboplasty. So it's either tuboplasty, which you can a little bit call surgery, because even surgery is one of the measures, but you can also do tuboflashing. But again, if there is no infection, that's when you only go for tuboplasty. But if there is a sign of infections, then you have to first treat, to give antibiotics, and then you go for a tuboplasty. Then we have Adio. Oh, this question. Adio Odunayo is saying, hello doctor, my menstruation started on 9th January and stopped on today, 11th January. When will I start ovulation? Adio or Doneo, we cannot know when you're going to start ovulation if we don't know the length of your menstrual cycle. So tell us, what is the length of your menstrual cycle? If we know the length of the menstrual cycle, it will be easier for us to calculate for you your ovulation day. Yes, daughter something, how are you and where are you calling from? Be very loud with your question. Be very loud, I'm not hearing you. Hello? Yes, how are you and what's your problem? Be loud, increase your sound.
I'm fine. I'm watching you from Turkey.
You're watching from Turkey. How is Turkey to K? Is it to K to Kie?
We are fine.
Okay, so what's your...
Fine, but too much cold.
Too much hold? Okay. So what are you asking? What's your point?
My question is, are you
Yes. Be fast and loud.
My question is, how can I do, I have 2 months and I didn't see my periods. Which method can I follow to see my periods?
You have tumors.
Yes.
Which type of tumors do you have? Which type of tumor do you have?
Sorry?
Which type of tumor do you have? You have a leiomyoma? You have fibroids?
So,
Please, let me know the type of tumors. You have fibroids. All right, so when you have fibroids, first of all, amenorrhea or no periods is one of the signs of fibroids. Okay? So you having no periods when you have fibroids, it is a clear indication that this, in other words, that's a typical sign of fibroids. So what you're supposed to do is to treat this fibroid. The most important thing is to treat the fibroid. First, treat the fibroid. When you treat the fibroid, you'll resume menses. Of course, you will have to treat the fibroids, do a fertility hormonal assay. You know with fibroids, there is an increase. It's brought as a result of an increase in the estrogen levels, high levels of estrogen. Estrogen goes up and progesterone goes down. So in most cases, people with fibroids will have low levels of progesterone and high levels of estradiol or estrogen. Therefore, you are supposed to treat this fibroid. But after treating the fibroid, then you'll have to do a fertility hormonal assay to check the levels of your progesterone and get progesterone supplements. I hope that is very clear with you, daughter. Is that clear with you?
I've heard you.
Yes.
Yes, it's clear. Thank you.
All right. Thank you so much, and thanks for following me. Say hi to those people in Turkey. All right, so let's go to another question here. Is from Beauty Naneworth. What are you saying? Please, what's the best remedy for yeast infection? I am a lactating mother. The best remedy for yeast infection, I always tell people that do culture and sensitive, because you know with yeasts, you're supposed to treat them with antifungals, antifungal medications, which may include the tablets plus pessaries or vaginal pessaries, okay? So, but if they fail, because I know by the time you're asking, it means that you've used several of those medicines, including those pessaries they put in the vagina and so on, and the infection is still insisting. So what I advise you to do is to do a culture and sensitivity. With a culture and sensitivity, you will be able to determine the exact bacteria or the exact fungi that is present and the medicine that can work on it effectively. So that's what I would advise. Yes, Simon, how are you and where are you calling from?
I'm fine. I'm calling just from Kampala.
You're calling from Kampala. So what's your problem?
It is pain
Okay? When did it start? When did you start having painful urination?
It was last year was it July?
In July. And I guess you've been taking some medicines.
Yes, a lot of them.
And it is still persisting.
Yeah.
Have you, do you have a discharge?
No, at first it was, anyway, like the time it happened, I think it was blood, but from there nothing has ever happened. It's just pain.
So you had, there was blood, and Anto Owasea, thank you so much. Anto Owasea is gifting us a lot of things. Kesbag, say hi to Anto Onasea. He's gifting us a lot. You know, we don't understand these things of TikTok very well. Okay, so if there was blood, then discharge, right now it's pain and it has persisted since last year. All right, now what you are going to do, I will tell you this. Do not take any more medicine. You are going to do what they call culture and sensitivity for two things. You are going to take a urine culture. You also going to take a urethral swab culture. So you do two tests, urine culture and urethral swab culture. But make sure that you're taking these samples when you've spent at least 2 weeks without swallowing any medicine, any antibiotic. Then after spending 2 weeks, actually minimum we say 2 weeks, but if it's possible, you can first spend a full month without taking any antibiotic. Then after a month of not taking antibiotics, you now do a urine culture and sensitivity test. That test will show you exactly which microorganism is existing that is making you have painful micturition, painful urination. When the bacteria is known, or when whether it's a bacteria, a fungi, whatever the case is, or a parasite, then it will be tested on various medicines to find which medicine specifically can cure that bacteria. Because right now you must be facing resistance, that every medicine you're taking, the bacteria is resistant to that medicine and they are no longer working for your body. So the more you will take these medicines, the more you will increase resistance in your body. So what I advise you, stop taking any antibiotic. Then when you stop taking antibiotic, even if you get a cough, don't take an antibiotic. First, allow for a period of at least, I think for you with that condition, because it's really risky for you, you may end up getting strictures. You've seen these people that they open, who fail to urinate. They are not able to urinate, and at the end of the day, we have to put a catheter here and the abdomen. And those conditions result from that. Therefore, what I would advise you is that do not take any more antibiotic. Don't take any more antibiotic. Allow 1 month, a period of 1 month without any antibiotic. Then after 1 month, do a culture and sensitivity test. It will tell you which medicine you are supposed to take. Take the medicine and we'll see what to do. Is that all you wanted to ask?
Yes, please.
All right, thank you so much and have a lovely evening.
Thank you too, please.
All right, so let's continue with our questions. Fahia Muhammad is saying, I got a miscarriage 5 times. I went to the hospital. They told me you have some bacteria like rubella, weps, and cytomegalovirus. All right, so did you treat? Because I know that the next question you're going to say, what am I supposed to do? What am I going to do? Treat, okay? Treat. If you have these infections, first treat them. They may be the ones causing your miscarriages. But also know that there are some other things that can cause miscarriages. For example, we have chromosomal abnormalities can cause miscarriages. These infections you've mentioned can cause miscarriages. We have cervical incompetence. There are women who have a weak cervix. They cannot keep the pregnancy for long, okay? By the time the pregnancy reaches 3 months, it has to get out because the cervix is incompetent. Then we also have hormonal imbalance, women with problems of low levels of progesterone or high levels of prolactin. Those ones will have early miscarriages. So there are very many causes of miscarriages. But now, since for you we already at least know that you have a cytomegalovirus and a rubella, then first treat them and we'll see if you can get rid of those miscarriages. Then we have Rashida. Oh, this question is running away. It's running away. It's running away. Sorry. And people say I don't answer their question. Okay, Rashida Pamela is saying, doctor, is it advisable to get in contact while menstruation? To get in contact with what? What is the question? I'm not understanding you. To get in contact with what while menstruating? I don't get the question. Please ask it clearly. To get in contact with what? Sherry Shamba is saying, doc, I was told I had an ectopic pregnancy and it was removed. Okay, it's now 3 months, I haven't gotten pregnant again. What could be the cause? There may even be no cause. First, allow the body to heal. When you conceive and get a miscarriage, remember sometimes the hormones are still high. For example, HCG levels are still high, okay? Sometimes even progesterone, in other words, there is a lot of hormonal interplay after having a miscarriage, okay? So therefore, you first allow the body to heal. Allow the body to heal. If it reaches 6 months, when you're not able to conceive, before conceiving 6 months, that's when it becomes a concern. It becomes a concern, and that's when you can begin investigations. But what can cause, let's say you've reached 6 months and you're again not conceiving, what can cause that? Number one, and the biggest culprit, would be tubal blockade. Blockage of tubes. When women get miscarriages, sometimes, almost times, they'll end up with blocked tubes. When you get a miscarriage, you get an abortion. Actually, if you've ever had an abortion or a miscarriage and you're not able to conceive again, think of tubal blockade. Think of tubal blockade. How does tubal blockade come about during a miscarriage or during an abortion? Number one, especially, during an ectopic pregnancy, we're talking about, sorry, I'm confusing things. We're talking about an ectopic pregnancy, but it's still the same thing. Now, how does it come about? When you have an ectopic pregnancy, they can operate you. They may operate you. When they operate you, they will open the tube. They will open the abdomen and go to the particular area where the ectopic is. If it was a tubal pregnancy, most times they will cut out the tube. Because at times you reach there, for example, this is the tube, okay? This is the fallopian tube. And the baby is here, the fetus is here, okay? The baby is here, this is where the fallopian tube is. Now let me demonstrate this clearly. I don't know if you'll be able to see. Sharifa, come and hold here. Okay, so this is the fallopian tube, and this is the baby. The baby is here. So when the baby is here, to remove this baby, most times, yes, you can try and remove the baby very well and leave the tube. But in most cases, the baby is fully attached to the fallopian tube, and you cannot separate the baby or the fetus from the fallopian tube. Therefore, you have to cut out the fallopian tube. What do we do is to cut from here, and here. So when you cut from here and here, you take away this part, including the tube. Sometimes you can do anastomosis and suture the tubes back, but at times it's hard. And even when you suture the tubes back, they can develop adhesions. So at the end of the day, you may fail to conceive when the tubes have blocked in that way. That is the first way. Then the second way, tubes can still unblock. Even when you've removed the fetus very well, you can have adhesions. Adhesions is when there is, you can have accumulation of blood into the fallopian tubes, clotting, of course causing clots, blocking the area. Adhesions is when there are formation of like, they are like roots, okay? The muscles are getting adhered onto each other. And that can result from that. So when you've gotten a miscarriage or you've gotten an ectopic pregnancy and you fail to conceive after, think about that. Therefore, you will be able to do an HSG X-ray to confirm whether your tubes are patent. If they are patent, power. If the tubes are patent, well and good. If they are not patent, we can open them. Another question here is saying, another question here, how can I unblock my fallopian tubes? This is a very good question. Is it charging? Teragange charging, but it's okay. Or maybe that's how it does it. It's not showing that it is charging. Okay, yeah, it is. So how do I unblock my fallopian tubes? Now, fallopian tubes, of course, you can't unblock the fallopian tubes alone, you yourself, okay? You can't unblock the fallopian tubes. But what you can do, you go to the hospital, there are procedures that can be performed. For example, there are people who do tubal flushing. Yeah, tubal flushing, or what we call hydrosalpingolysis. But that is a weak method. It sometimes works, but it's weak. It is not so accurate. It's not so effective as people who use catheterization or canalization. That is also another method. Then you can also do tubal surgery. You can do surgery. You can do surgery that is open surgery or do laparoscopy. All those methods can be used to unblock the tubes. Then another question here, Sherry Shamba is, okay, we've answered this. Albert Obed, we've answered you. Gracious Thurai is saying, Doctor, I missed my periods 2 years ago. Sorry. 2 years, you're not seeing your periods. I missed my periods 2 years ago. I have been using Depo-Provera for the past 3 years. My question is, how can I get my periods back? All right, I don't know what your age is, but if you've been using Depo-Provera for that period of time, then we are likely to be having a problem, an issue of hormonal imbalance somewhere. So what I ask you to do is to investigate. I think most of you have been watching my lives. You know, when I'm dealing with any disease, when I'm dealing with anything to do with infertility, to do with women, reproductive health, I talk about investigations. Why do I talk about investigations? We no longer use medicine of hearsay. I had someone so and so told me that if you use this medicine, you get no. We want evidence-based medicine. What is evidence-based medicine? It is that medicine that is given after confirming that this is the problem, this is the cause, and this is the remedy. After confirming what is the cause, then after confirming the cause, we can now have the remedy. So you need to do tests. Go and do a fertility hormonal assay, full profile. After doing a fertility hormonal assay, go and do a pelvic ultrasound scan. With those two results like this, you'll be able to know what is causing your amenorrhea, what is making you fail to get to have periods for a period of 2 years. Then Anita Arthur is saying, how do we treat fibroids? Fibroids are very funny and very stubborn. Very funny and very stubborn. I said that fibroids come as a result of increased or accumulation or long exposures, prolonged exposures to estradiol, to estrogen hormones. Okay, that's how people get fibroids. Now, to treat it, there are two methods. There is the medical and the surgical. The simplest, is it simple? The most accurate is the surgical, is operation. Open the abdomen, take out the fibroids. The fibroids can be operated using open surgery, but they can also be operated using laparoscopy. Then secondly, we can use medicines, injections. Those medicines are like anti-cancer drugs. So the likes of leupride and goserelin can be used to treat fibroids. I think I'm with you. The answer is clear. But also, that treatment, either deciding on whether to use any of those, should be made, that decision should be reached onto after understanding the following things. Number one, your age. Two things, age and fertility intentions. What do I mean by fertility intentions? What's your plan as far as conceiving is concerned? Are you planning to have more children? If you're planning to have more children, then we can look at which method to use. If you're not planning to have any more children, some people even decide to remove the uterus. Because it is having fibroids, just take it out. And also, we shall also look at the size of the fibroids and the location of the fibroids. Is it a pendulous fibroid? Is it an intramural? Is it a pedunculated fibroid? Is it intramural? Is it subserosal or submucosal? All those factors can determine which method to use. Okay? So, one, the size of the the fertility intention. Two, the size of the fibroid. Three, the location of the fibroid. Those factors must be looked at, but all those are options you can use. Chiamaka Nua, this name here. Please, this one is saying, please, I want to speak. Okay. Doctor, I'm 28 days cycle, sometimes 27, other times 26. I saw my monthly flow on 29th of December. Please, sir, when is my ovulation day? Thank you so much. These are the questions I want. Someone gives us the length of her menstrual cycle. It becomes so simple for us to calculate her ovulation day. Now we are going to use this. We are going to use this. So, what we know is that we know the length of her menstrual cycle. Because you have 20, it keeps on changing. This means it's an irregular menstrual cycle, 26, 27, and 28 days. Therefore, we are going to use 26. Those of you who have been following me, you know why we are using 26. We use the shortest, okay? We use the shortest. And the shortest is 26 days. So the length of the menstrual cycle is 26 days. Okay? So now those of you who know, and I want clear answers here. I want answers here. Tell me, what are we supposed to do? I want answers. What are we supposed to do? The length of the menstrual cycle is 26. We want to calculate her ovulation day. What are we supposed to do? Please tell me. Give me answers. Those of you who have been following me, I know you know. Now, what are we supposed to do? What are we supposed to do? The length of the menstrual cycle, we are taking it as 26. What are we supposed to do? Someone very clever here is giving me an answer. He's saying we should say 26 minus 18. Thank you. 26 minus 18. So what is the answer? 26 minus 18, what is the answer? Today I'm not going to give you everything. So tell me, what is 26 minus 18? What is 26 minus 18? People are getting the answer here. Someone is giving me 8, another one 8, 8. Someone is giving me 9, you man. All right, so it's 8. So 26 minus 18 is 8. What else we are supposed to do? We are supposed to say 8 plus 4. And what is 8 plus 4? What is 8 plus 4? What is 8 plus 4? Okay, everyone is having the answer. 12. Thank you so much. Okay, 12, yes. Anita Arthur, yes. So 12. Now, that means, okay, then we have 12 plus 5. That is, what is the answer? 12 plus 5. We have to get for her the answer. We have to know the length of her menstrual cycle. Guess back. Is it fine? There. Okay. Okay, so, all right, people have it. 17. Thank you. 17. Now, Onita Osiaso, you're saying 27. No, this is 17. Okay. So, now if we have 17, so what is the answer, guys? What's the answer here? So what's the ovulation? What's her ovulation day? We have all these ones, 8, 12, and 17. Which one is her ovulation day? I'm looking at those that have been following me. Don't disappoint. It means I'm a bad teacher. Okay, thank you, Sherry Shambea. All right, everyone is having the answer now. So the answer is 12. 12 is her ovulation day. So this woman will have her ovulation on the 12th day. But remember, she is going to be fertile from the 8th day up to the 17th day. So from the 8th up to the 17th day, she is fertile. All those days, she can get pregnant. But all these days, she can get pregnant, but the most fertile day is the 12th day. Now, if she had her periods on the 29th of December, 29th of December, then what are we, when is she going to have her ovulation? 29th of December, we can calculate. 29th, 30th of December, 1st November, 1st January, 2nd, 3rd, 4th, 5th, 6th, 7th, 8th, 9th, 10th, 11th, 12th, 13th, 14th. Papa. Now, let's give these ones numbers. This is day 1, day 2, day 3, day 4, day 5, day 6, day 7, day 8, day 9, day 10, day 11, 12, 13, day 14, day 15, day 16, day 17. That is on the 15th. So now, Miss, your ovulation day is on the 10th. On the 10th of January, which is the 12th day, was your ovulation day. Therefore, your ovulation day was yesterday. Your ovulation day was yesterday. I hope this is very, very loud and clear. On to Oasis, how are you and where are you calling from? And thanks for gifting us.
Good evening to you, to your family and everybody, and Happy New Year.
How are you? Where are you calling from?
I'm calling from Germany. I have been following you since 5 years.
You've been following me since 5 years. I've not been on YouTube for 5 years. Is it 5 years now?
On YouTube, I've been with you.
Okay, all right. Thanks.
So, I've been following your treatment and the way you explain things, I understand. But the problem I have since 2020 is my menstrual cycle. It will come for a period of 3 months, then 6 months it will vanish. Then I went to meet a doctor and she checked, and my age by then I was I think 36, and she prescribed a tablet for me. I asked what.
Your network is not good. You've gotten off. Sorry, we've lost you. Your network. All right, let me continue with the questions. Anto Oasis will come back and ask her question. We've lost you, sorry.
Can you hear me?
Yes, we can now hear you.
Okay. I said my problem is hormonal balance. I have been trying to take some
So now, Anto, to cut the story short, when you look at your hormone levels, is progesterone normal?
I don't know, but normal I went to doctor to check.
Do you have your results with you?
Huh?
Do you have your results with you?
Pronis what?
Do you have the results with you?
No. She only just writes me a tablet I have to take.
Before you see, you know, like I've said, I do evidence-based medicine. I want to know what exactly, because yes, if we have hormonal imbalance, we have like 10 fertility hormones. Which hormone exactly has a problem? Is it progesterone?
That I can't say.
Oh, now how am I going to help you?
Yeah, every month normally, last October was the last day I went to check. She saw the menstruation, the blood stick there.
No. You see, all that is now won't help us. What we need to do, like I've said, evidence-based medicine, we need your results. We need to know the levels of your progesterone. We need to know the levels of the other fertility hormones. If we know them, you can get the medicine specific for that.
Okay. And doctor, sorry for all that thing. Normal, every month when I want to have my period, I used to have pimples, one at the face. Every month it come out, my breast is up, and I feel pain, but it's not coming out. I don't know. I can't really tell.
Yeah, of course, we still have the same problem. You have a hormonal imbalance, though it will be very hard for you to treat it when you don't know exactly which hormone has a problem. Okay, so you need to know which hormone has a problem, and you can also add on a pelvic ultrasound scan to also confirm that you don't have fibroids. But we need to know which hormone has a problem, then you can get treatment. You can get that treatment.
Yes, I have a fibroid, but it's just a little centimeter.
Oh, a fibroid, however small it may be, it will affect you. It will affect your fertility. It can affect your periods.
Okay.
So it means it.
What kind of things should I have to do now so that when I book appointment,
You go do a pelvic ultrasound scan, do a fertility hormonal assay, and with the fertility hormonal assay, do for me the following hormones. Okay? Number 1, do for me progesterone. Number 2, do progesterone. Number 2, do for me estradiol, or estrogen. Number 3, do for me luteinizing hormone, or LH. Number 4, you do for me follicle stimulating hormone, FSH. Number 5, do for me prolactin. Number 6, do for me AMH, anti-mullerian hormone. Number 6, do for me T3. Do for me T4, TSH, and lastly, do testosterone levels.
okay.
Thank you so much.
Okay, thank you so much, and God bless you.
God bless you too, and have a nice time. All right, we have another question here. Pet Alv, why can bleeding occur after ovulation? What does it mean? Yeah, it is not bleeding that occur that is normal. That is normal will be light spotting. It will be light spotting. But if it's heavy bleeding, that is abnormal. But if it's light bleeding, which will happen for only 1 day spotting, that is okay. It is normal and is one of the signs of ovulation. Amina Bashir channel, can my hydrosalpinx cause brown and scanty periods? No. Charema Regina, please doctor, I had an ectopic pregnancy last 2 years. Please, can I be able to conceive again? I'm watching from Ghana. Yes, say hi to those people in Ghana. Yes, you can conceive again. There is no reason as to why you shouldn't be able to conceive. So you can conceive even after having an ectopic pregnancy, as long as everything is still normal. Then, I'm watching from YouTube. All right. Okay. Takorabi Babra, you're back. You had gotten lost. Janet, the sound is in fast. Switch off your phone. Oh, okay. Janet Mwenda, doctor, is Litraz and Clomid taken the same? Litraz and Clomid do almost similar things, okay? So you can't take Litraz at the same time you take clomiphene. You choose and you take one of them. Ingrid Kakara, Menopa, Pagono, and Methodine. Can I get the government hospital or only at gynecologist? Now, I don't know where you are, which government hospital that is, but what I know is that these drugs are readily available in all hospitals. And okay, they are available. They are available. I don't know. They may not be available in one hospital or the other, but they are readily available, so you can buy them. I don't know whether they are available in your government hospital, but they are available. Queeneth Diokpa, good evening, doctor. Okay, good evening to you. Leonie Jamel, good evening from Germany. Endometriosis patient here. All right, sorry about that endometriosis. I guess you're under management. And this endometriosis is also a very bad disease which can make someone fail to conceive. But we maneuver one way or the other and find a way of making someone conceive. Albert, thanks. All right. Alberta Obedi, please, how can I unlock the fallopian tubes naturally? I don't know of any natural means of unblocking fallopian tubes. The only means I know are the modern means. Which modern means are flushing or the tuboplasty, the hydrosalpingolysis, to doing a tubal surgery, open surgery, or laparoscopy, and 3 is doing recanalization. So we are going to say bye-bye to those of you on TikTok. So follow us on YouTube. Let's continue the conversation on YouTube. But for now, we are off TikTok. Thank you so much. Those of you who have been watching on TikTok, we are now continuing our live on YouTube. Go to YouTube and search Ask Dr. UTHUMAN, and we'll continue the conversation from there. Okay, so we are continuing our conversation today, and we are continuing the conversation here on YouTube. So let me continue with the questions. Okay, Sherry Shamba is saying, thank you so much, Mr. Doctor. I was worried for nothing. All right, thank you so much. Princess Grace, good evening, sir. Ever since I removed my IUD, my monthly flow lasts for 2 days. My monthly flow lasts for 2 days. It's okay. 2 days is normal. It's not abnormal to bleed for 2 days. I've already said that periods should last between 2 to 7 days. So it's okay. It's okay. Come back to where you were, but it is still okay. Bleeding for 2 days is normal. Pet Alvi, meaning 13th is her ovulation day. No, it was 12th. Yosh Explorers, hello doc, I'm from Kenya, but now I understand through following you my problem. It will finish. I will come to Uganda to meet you people. All right. Say hi to those Kenyans and say hi to the president is called Uhuru, Ruto, William Ruto. Say hi to the man himself, William Ruto. Babi Namukasa is saying, Doctor, Happy New Year. I'm sorry, Doc, but I got a miscarriage of twins in April. Sorry about that. Up to now, I haven't conceived. What can I do? What can you do? What can you do is to run a fertility screen. Do a fertility screen. Let's know what is happening or what is not happening. When you do a fertility screen, we shall know what is not happening or what is happening. Then you can get medicines to boost your fertility. Linda, oh, it's gone, it's going. And when I scroll and leave a question, people complain. People complain that I have not answered them. Okay, Muhammad Abdurahi is saying, your lecture is very nice. I'm from Ethiopia. Say hi to those Ethiopians. Who is the Prime Minister of Ethiopia currently? Kesba. Who is the Prime Minister of Ethiopia? Muhammad Abdullahi, tell us the Prime Minister of Ethiopia. Who is the current Prime Minister of Ethiopia? We need to be up to date. Because you guys don't have a president, I think. You have a Prime Minister. Amina Nakate, greetings, Doc. When I'm in my period, sometimes I feel pain in my pussy. Oh, like muscle pull, Doc. What could be the problem? It comes as labor pains. That is normal. Those are hormonal fluctuations, okay? Those are hormonal fluctuations. It's normal to have some pain during your periods. That pain in your vagina, it's sometimes normal. So what you're supposed to do is to just take painkillers and also take some muscle relaxants, okay, like myospasm. Peace Bona, is folic acid to get pregnant faster? Folic acid won't make you pregnant faster if you have any other problem. We take folic acid like a supplement because some of you ask me whether to take folic acid when you have hormonal imbalances. If you have a hormonal imbalance, like for example, you have low levels of progesterone, folic acid won't help you. Folic acid won't help you if you have hormonal imbalance. Folic acid won't help you if your tubes are blocked. So the issue is not all about acid. Folic acid should be used when we know that we don't have any problem. Everything is okay. Folic acid and all those other vitamin supplements are to just promote the very good health of your reproductive health. Kechi Gabiro, Maureen, I almost missed. Okay. Leon Jamal is saying, I don't know why women in color are much like get fibroid. Pelt, yes, light spotting. All right. Shala Mwamba, hi doc, happy new year. I love your lectures. I'm 34 years and I have a 26-day cycle. Have never given birth. Oh, sorry. But before, I've never given birth. But I want to conceive. Now I can conceive. How can I conceive twins? The first issue is you've never given birth on your is it your choice or you've just failed to conceive? Because those are two different things. Someone may have been maybe not meeting a man, that is number one. Number two, may have been not using family planning or using family planning or whatever. So in other words, someone may have not conceived because they don't want or they are not yet ready. But there is also that person, you 34 years, has been yearning or has been wanting to conceive, but you're not conceiving. Those are two different things, and we need to evaluate that before I can give you an answer. Amina Bashir is saying, where the question is, okay, is saying, sir, I have the result of my LHFSA prolactin. How can I show it to you? All right, if you, I think you can book an appointment. Book an appointment on the website. It is www.druthman.com. Book an appointment. We shall have a private chat, and I get to review your results. Let me write for you that website. www.druthman.com. There you book an appointment and we'll see what to do. Kechi Gabiro, Maureen, I did TSH, prolactin, progesterone, and free T3. Everything is okay. No blocked tubes, no fibroids, but can't get pregnant. Any advice? Wow. You did fertility hormonal assay. Okay, how old are you, Kechi Gabiro, Maureen? How old are you? And in this, I see these tests you did, there are some hormones still missing. You did do AMH. Because AMH is able to tell us whether you have viable eggs, whether the eggs are viable. And also, have you done an ultrasound scan to confirm that you don't have any problem with the uterus? And I've also maybe also doing a transvaginal ultrasound scan to look at the size of your eggs. That is also very important. Like I've already said, it is very hard to find someone failing to conceive when there is actually no problem. When you fail to conceive, it means there is a problem. Ingrid Kakala, I was told I don't have eggs, but still menstruating though irregular. Can I still get pregnant using drugs to stimulate eggs? If there is completely no eggs, it becomes hard. We advise donor egg. But sometimes they tell you, yes, you don't have eggs. When you still have a few, okay, that's when we can do a stimulation. So we need to determine your AMH levels. Pet Alva is saying, what causes lots of discharge, e.g. 20 days direct, and how can stop it? The discharge, watery, a bit yellowish, considering that is woman has adenomyosis. Now, most discharges are caused by, most of them are caused by those infections, the fungi, the fungal, the candidiasis of this world, or what most of you call yeast infections, and some of them are caused by bacterial infections. So I advise you to do an HVS, high vaginal swab. Take a sample of those fluids or of those discharges, do tests, and we find out what is causing that. But mostly, there are those microorganisms I've talked about, the fungi, the bacteria, and sometimes virus or parasites. Temi is saying, hi doc. Where? Oh, it's running away. Question is running away. Okay, hi doc. What are the options for a man with 2% morphology? What do you mean by 2% morphology? What exactly do you mean? This is not clear to us. I know you must have done a sperm analysis. Read the results very well. There's nothing like 2% morphology. But I guess that's a fertility, that is a sperm analysis result, but read it clearly. We shall be able to answer you. Ohema Sapona is saying, can genetic test give you false results? All is accurate. Genetics results are accurate. Sapoma, genetic results are accurate, except, of course, there are times when you get results that are not accurate, and that may result from maybe the laboratory, the technician who has performed it, or maybe there was an error somewhere. Those artifacts we talk about, poor reporting, poor recording. Sometimes you may get results that don't belong to you, sometimes because of those minor, we call them minor errors in the laboratory, but they become bigger things, bigger issues. Then it can be as a result of maybe some of the items, drugs, reagents, what were used maybe were contaminated or expired. In other words, as far as genetic testing is concerned, it is accurate, but the impurities or the inaccuracies may come as a result of human error or a problem with the reagents used. Okay. Temi is saying, hi doc, what are the options for, I've said 2% morphology, that doesn't exist. Amina Nakate, okay doc, thank you, I was so worried, all right. Okay. We have Joe Go for Growth Media is saying, good afternoon from Sierra Leone. I and my wife gave birth to our firstborn, and her I and my wife gave birth to our firstborn. On her 1-year birthday, we lost her. Sorry about that. On June 6, 2023. Since then, she's struggling to conceive. What to do now? Do a fertility screen. That is the answer I would give you. Do a fertility screen. Let's find out why she's not conceiving. And a fertility screen should involve both of you. You should both do a fertility screen. Peace Bonner, thank you, right? Ingrid Kakara, booking an appointment, payment made, I don't have it. Payment made, method, I don't have. Booking up an appointment, payment method, I don't have it. All right, don't have a payment method. Which method? Because on our website, we use Flutterwave. We also use SendWave. So you can either use Flutterwave or SendWave. Those are the methods that can be used. Alberta Obed, when am I having my ovulation? I always feel pain. When I am having my ovulation, I always feel pain. All right, that is normal. Normal. It is very normal. It comes as a result of hormonal fluctuations, and it is very normal. Leon Jamal is saying painful period are from a form of torture, especially if you are a EDO patient. Oh, I have not gotten it clearly. Maybe you're conversing with some people because I don't. All right. Then go for growth media. We experience irregular periods. Okay, I think I've already told you to do a fertility screen. Florentin attain my chance with 2% morphology for men. Really, this question, people, you're asking this question about 2% morphology, but I don't understand it. What exactly do you mean by 2% morphology? Uzoka Ulochi, because I know you guys are looking at fertility, at sperm analysis results, but read those results very well. There's nothing like 2% morphology. Yes, there's nothing like 2% morphology. Uzoka Oluchi is saying, good evening, doctor. I did a hormonal assay test and the doctor said everything is fine. And he also said I should do HSG, which I did, but still failed to get pregnant. What can I do to get pregnant? You did HSG and the tubes open, and for fertility hormonal assay, did you do all hormones? I've found people saying that I've done a hormonal assay, and you find that they have done like 2 hormones. You find they have only done progesterone, estrogen, you find they have only done prolactin, etc. So you're supposed to do all the 10 hormones I've mentioned here. Do all the 10 hormones. Let's confirm that all those hormones are fine. That's when you can say hormonal assay. That's why I tell you, do a full fertility hormonal assay. Are we still here, Kesbag? Okay. Then we have from semen analysis. Yes, I know that. Gamufaya Christabel, Doc, I had my menses on the 4th of January and it ends on the 7th of January. Please, when is my ovulation? I don't know how to calculate it. What is the length of your menstrual cycle? Okay, we need to know the length of your menstrual cycle for us to calculate for you your ovulation day. Okay. Okay. Janet Mwenda, Doc, is litrazole and clomid dosage the same? No, it is not the same. Of course, this one we take. This one can be taken 2.5 milligrams litrazole, and for clomiphene it's 100 milligrams. Not the same. Okay, Janet Mwenda. Okay, Janet Mwenda is saying, no, tell me, I mean, what are the options to conceive? Is it possible to conceive naturally, IUI or IVF? You see, I don't know exactly. Tell me. Thank you so much for watching Ask Dr. UTHUMAN YouTube channel. For those of you who are watching for the very first time, please don't forget to subscribe and also press the notification bell in order to be notified of any important video. Those of you who would like to have a private chat, go to the website www.druthman and book an appointment. And also, those of you with challenges concerning your IT, please visit our station, our YouTube channel. It's called IT.next. It is run by the man behind my camera. The man behind my social media is called IT.next, Mr. Kesbag. Thank you so much and have a nice time. God bless you.